This is an example of a guinea worm. This one is from Burkina Faso. That is the cause of all the misery. Has been around since ancient Egypt, at least. It's one worm.
When I think about guinea worm, I think about this disease that just completely debilitates people. It causes immense pain and suffering, but at the heart of it, it prevents people from being people, because all they can think about is that excruciating pain.
First of all, thank you all for being here, and thanks to the Chan School, the School of Public Health, for hosting us. Maybe I'll just briefly say, this is sort of like a family reunion of my two families, or two of my families. I have deep roots here at the Chan School and as a graduate, and most recently actually teaching here during the J term. So doing some work here, but then also recently while I was at CDC, met many of the folks and the great work that was being done at the Carter Center, and joined the board about 2 years ago. I think one of the best stories of public health is how small the world is when you get to do work in public health. So I first met Sarah and Chad in April when I visited the work at the Carter Center, and saw Sarah there in Jamina. And then actually just recently, as part of the J term, was looking for a teaching fellow, and across my screen came a CV, and I met Jake Wheeler in the back, one of my teaching fellows, and it turns out he was one of the guinea worm warriors at the Carter Center. So it's really just a wonderful family to sort of an opportunity to unite the family here at the Chan School, the School of Public Health, and the Carter Center, which I have come to incredibly admire, and see the incredible work that's being done by the folks there. So I want to just thank you all for being here and for the opportunity to join you here. And then I will leave it to the people who are doing this great work. So to you. Thank you, Emily.
Well, thank you, Rochelle, and thanks for everyone coming out on this snowy evening. I wanted to extend a special thank you to our Carter Center family folks that came out tonight to join us, as well as a few other guinea worm warriors in the audience, Dr. Leah and Dr. Diane, in addition to Jake. I think I would reiterate, it seems like public health is a family, and guinea worm is definitely a really close-knit family. And so I thought maybe I'd kick it off by asking Sarah, since the origin story has a lot to do with you, maybe you can give folks a little bit of an understanding of how the film came to be and why that's important, especially in the way that the Carter Center acts and interacts with countries.
Thanks so much, Emily, and thanks also to all of you for being here. It's really an honor and a privilege to be here today and to be part of this documentary screening and to share some stories. When this all started, I was in South Sudan as the country rep for the Carter Center office there, and you saw the Dr. Riek Guy Kok, who was in the documentary, who was at the time the Minister of Health, and he was really passionate about documenting the human side of the story of guinea worm eradication, especially in South Sudan. I think, we know that if we talk about 3.5 million cases of guinea worm, each of those is a person. So there's a person behind all those numbers. But there's also the story of all of the people who went to extraordinary measures to make this happen. And that was really important to him to document that. And I think it's timely that the documentary is released now. I think one with President Carter's recent passing to help document the legacy of this program, and I think you heard at the end mention of this program laid the foundation for the health structure in South Sudan, and that's really important in a place where passive facility-based health structures aren't going to work. You have to be able to go to communities and to reach them. And so that's part of the legacy of not only the global program, but the program in South Sudan. And I think the other point to mention in terms of the timing of the release is thinking about how far we've come in the eradication campaign and how close we are to eradication. I mean, this is really the tail end. And I think globally we need to be thinking about what we can all do together to really accelerate efforts to get across the finish line at this point where we have 10 cases in 2025, but 10 is not 0, so we're not there yet. And so telling the story, I think, is really important at this point in the campaign.
Thanks, Sarah. Rochelle, I think you have an interesting perspective joining the board. You oversee some of the budget discussions and understand that this eradication is expensive, takes longer, is a bigger struggle than most people think, that maybe don't work in public health. What do you think is necessary for political will in order to finish the job, especially since when you were in Chad, you were there at a very high-level delegation, and I'd love to hear what you think.
Yeah, first I'll just say, I mean, it's easy to say, well, there are only 10, the work's really been done. There were 3.5 million cases annually, we're down to 10. I do want to just sort of double click, they say that in government a lot, double click on something that I don't think has really been said loudly enough. So smallpox was done with a vaccine. When we are talking about guinea worm, we don't have a treatment, we don't have a vaccine, and we don't have a diagnostic. So when you think about like how remarkable it is that this work in public health has been done without any medical countermeasure, but the will of the people doing the work and the will of the communities and the desire to do this together. I think, and I have sort of talked at the board level about, first of all, how hard it is. The R0, the anticipated R0 of this disease is around 80. It has a reproductive cycle that takes a year to see whether your interventions work. So the fact that all of this is happening in the context of almost everything that seems like it's conspiring against it just sort of demonstrates what the will to actually do this activity can mean and do. I would also say that yes, there needs to be political will, but I would also say don't discount the will of all the people in this room and all the people who are not former presidents of the United States to do that work. And I say that because President Carter, when he sort of created the political will, he did it when he wasn't president, right? So certainly he had a name and his long history and his incredible history behind him, but he was able to generate this when he wasn't in politics. And so I just want to sort of reiterate what all of us can do to garner the guinea worm warriors who are on site in the places that have these last 10 cases are able to generate that political will within those villages. And what was so incredible to me, and I know that some of this was because I was there, but I went to a school in Chad, and if you asked any one of those tiny little kids about how you eradicate guinea worm, they could have told you better than anybody in this room, I dare say, sorry, almost anybody in this room, and they were all wearing straws. That was like their first toy they ever got. So political will comes in a lot of different ways and flavors. It may or may not come from White House and Congress, but it comes in a lot of different ways, and I would sort of say be creative as to how we think about what that political will looks like.
That's a great answer. Sarah, for endgame challenges, I know that we've been doing guinea worm because we are looking at reducing suffrage for humans, but we've had the additional challenge of animal infections. I think one question that I'm often asked, and I typically when working with the media wants to know about if you eradicate it in humans, do you have to eradicate it in animals? How do those two things impact each other in terms of the end game?
I mean, I think that is one of the core challenges that we're facing in the end game. I think knowing that it's the same parasite that infects humans, that infects animals, we need to achieve eradication in all hosts to achieve full eradication. I think when we think about the course of the campaign between 1986 and 2010, there was a 99.99% reduction achieved primarily through behavior change interventions. And then we started to see animal infections, primarily in domesticated dogs in Chad. And so that really, I think over the past really since 2020 and most recently since 2023, we've really accelerated the research agenda to think about all of the endgame challenges, the animal infections being one of those, and how can we better develop new interventions and better target existing interventions to really impact the animal infections. And I think already in Chad, we talked about Chad being the most endemic country in the world in 2019 with over 2,000 dog infections. For the past 6 years have seen each year they've seen reductions. So 6 consecutive years in a row, Chad has seen reductions from 2,000 cases, 2,000 infections in dogs down to just over 100 last year in 2025. So we can also see that the interventions that we do have already are working to reduce infections in animals. So I think that's an important demonstration of success, even though we have remaining challenges with animal infections.
Trick question. Why is 10 cases not good enough?
Well, we're talking about eradication, right? It's different, it's special, and 0 is an important number because when you get to 0, then we don't have to worry about it anymore. So if there's 10 cases, then that means that there's an opportunity for the parasite to continue with its life cycle and for the number of cases and infections in animals to go up every year.
Rochelle, maybe you can share with the audience, and I know this is a very educated audience, but we will be using this for a podcast later, so just think that we're also having all the thousands of people for the podcast. Maybe you could talk a little bit about eradication and how rare it is, because I think most people have an assumption that we've eradicated all sorts of diseases, and it's easy peasy, and we should be doing a lot more of them.
Yeah, sure, we should be doing a lot more of them. One of the things I think we really don't necessarily recognize is we've done it once with smallpox. And so that we are down to 10 cases, and that we're actually actively working. I did a lot of work while I was at CDC on polio as well. We still have more cases of polio, endemic polio at that Afghanistan-Pakistan border. But polio has been really tricky and really hard, not only for endemic polio, but vaccine-derived polio. So I do want to sort of talk about, there's been one eradicated disease in cattle, but you can count them on, never mind one hand, you can count them on a paw or something. But, this is really, really very, very, the rule book on this for diseases in general is pretty thin. The rule book on diseases like guinea worm, where we don't have any medical countermeasures, is really unwritten. And so I do want to sort of talk about what Sarah just said with regard to 10 cases. Like, genie almost in the bottle doesn't count. I mean, it's wonderful in terms of what has been done to sort of eliminate and alleviate suffering. But in terms of what you always live with is sort of the dark cloud of when will it recrudesce? And that's why it's so very difficult. The other thing I just want to add to what Sarah noted was that at a time when there were 3.5 million cases a year, we didn't see like tons of dogs and baboons walking around with guinea worm. We have seen these now probably as an exception and not a rule. I don't think we generally think of the dogs or the baboons as an easy host to infect. Because if it were, then when we had 3.5 million cases, boy, would we have seen a lot more of that infection. And so the good news is that because we're down to so few human cases that we can now like really spend a lot of time and energy to understand what is in the animal population, and to really make sure that the work that we're doing to eliminate disease and eradicate disease in humans is also working in animals. And we've always said at the Carter Center, at least during my tenure on the board, that if ever we were to find that it is circulating wildly in animals, that might actually temper our enthusiasm for being able to eradicate this. But we haven't been seeing that. We've in fact seen just the opposite.
Sarah, you know a lot of people in this film, so I feel like you and Jake and some others, when you watch it, you're like, I know him, I was there. Is there a character or a moment or something that is special to you that maybe can help the audience connect to what it means to be a guinea worm warrior and to work boots on the ground?
Yeah. I think that it's true. We look at this, and I think for Jake and I, also having worked a long time in South Sudan, we do look at that, and I think you saw McCoy Samuel, who has been the director of the program since it started in Southern Sudan, and a lot of us were trained under him, and his enthusiasm and his excitement around guinea worm is translatable, is all of us kind of, it's contagious, and we get that. But I think, to me, there was, you heard Dr. Frank Richards. He was one who said, I wrote a lot of grants for guinea worm, and I didn't get any of them funded. But he also said that he was really inspired by the heroism of people who were on the ground and supporting that fight. And I think for me, that really sticks in my head, because one of the things that is easy to forget when you're looking at the numbers, when you're looking at the data, when you hear the story, is what people call the daily acts of courage that happen you saw it all here, but people who are, it's easy to point out all of the reasons why this can't happen, but it takes lots of people to say, okay, I'm actually going to try to do this. Let's see if we can cross that river. Let's see if our vehicle stops. We're going to start walking, and we're going to camp out for however many days. And if it turns out that we were looking for a case and they didn't actually have guinea worm, well, that's okay, because we checked. And so I think there are really a lot of challenges that are faced on a day-to-day basis that are hard to articulate. And so to me, it's always trying to remember those daily acts of courage that everybody does, especially working with communities on the ground.
Can I just say one? So I am not one of those heroes and warriors that, like several in this room. I did take 4 flights to get to Chad. And then I got to Chad, and I think we drove an hour and a half to get to a site and to this school. And then I think Adam said to me, I'm so sorry we couldn't take you to the field. And I said, gee, I thought I was in the field. But it just reminded me of what those acts of, I turned to Sarah when the truck got stopped, and I said, does that look familiar? And she's like, oh yeah. So it just, these are incredibly selfless people doing incredible work, giving so much up in the spirit of others. And my hat goes off to like all the people doing this work day in and day out. I really did hear stories from folks in the team that sort of said, well, the bus dropped me off and they said, walk 6 hours that way. And that's kind of the stories that you hear from people doing this kind of work. I also just want to highlight the quote, when you do that kind of work, you are part of that family. And one of the folks in the film said, we were part of them. And that doesn't happen if you are not in it with them. And so that the Carter Center, I think one of the best parts about the Carter Center and all the work that they do around the world is there is unity and community with the folks who are doing that work. And the community actually recognizes the folks from the Carter Center as self. And that is a high bar to achieve.
One thing that makes me reflect on traveling with President Carter during my time at the center is that when we would go out to a community, he greeted the community and the leaders and the village volunteers the same way that he would greet having former heads of state come visit us at the office in Atlanta. Same if we had, I don't know, Stevie Wonder stop by, which really did happen. And I think that he really set a tone that where we work is because we've been invited there. We are there as guests, and we are partnering with the country and with the community. One of my favorite pieces of our mission statement is failures an acceptable risk, but the failures not to try. And I think guinea worm is one of those storylines that kind of speaks to that. In working on the documentary pretty much since 2018 with Sarah and others, I would say that even though public health is sort of the backdrop of this film, and President Carter is the celebrity, and South Sudan is also a backdrop, I think there's some lessons learned about overcoming seemingly insurmountable things, and then also finding partnerships in some unlikely places. Like the 1995 ceasefire, nobody thought that you'd have a former U.S. president, a warlord, a couple of other questionable folks, a few child soldiers, and and the CNN. I always loved that he called it the CNN. In order to push what was then the longest humanitarian ceasefire, and it ended up lasting about 6 months. Open to both of you. What lessons learned or things do you see that the Guinea Worm program has been able to inspire or will inspire in other programs, or to get us to zero? Either way you want to go with it.
Yeah. I think one we've touched on already, I think, is and especially someone who's worked a lot of my career in South Sudan, in a place where sometimes there aren't roads or schools or ways to get to places. And even if there are health facilities, they may not have medicines, they may not be staffed. And so the influence that the success of the guinea worm eradication campaign in South Sudan has had on the rest of the health structure, to me, I find that inspiring. Even the Minister of Health, he started his Boma Health Initiative, which was all about using the footprint of the guinea worm eradication program to reach communities with other health services. And I think to me, that's a real inspiration. I think also, again, with the daily acts of courage, when I think about, now I'm based in Atlanta, and, I think about, I have to stay up late and type some, reports or something. And I think about, okay, but there's people who are out there fighting this disease, who are sleeping, under the stars in the bush, crawling through thorny bushes to be able to reach locations and to do all of these things. And if they can do that, then surely I can stay up till midnight to work on this report. It's, and so I think it provides a level of perspective in terms of the inspiration that we can draw from what it is that people have overcome to make this successful. And it's not just one person. It's not just President Carter. It's not just the Minister of Health. It's not just one person. It is thousands of people around the world who have dedicated themselves and shown that type of courage that have made this successful. And I find that broadly inspirational.
I don't have huge words of wisdom here, except to say that public health is not getting a great rap right now, and that has nothing to do with the incredible quality of the people. It's because they're trying to get us down. And what I would say is this work and the work of you all and the work of the people in the field demonstrate we're not going to be shut down, because we can do bigger and better, and we're gonna do it by our actions and by our accomplishments and by demonstrating how we give to others, and by continuing that work quietly or loudly or inspirationally, and mobilizing incredible communities and incredible people to do all the things that people said couldn't happen.
I totally agree. What advice would either of you or both of you give to public health students that are interested in working in the field?
That's a really good question. I think, one, you could not have described to me what this experience would be like before having it. I think that, and perhaps I wouldn't have signed up for it. I don't know. Maybe it's for the better. But I have, in every different point in my career, I have always been so grateful to have had the opportunity to spend the type of quality time in the field, and I mean in the field, living within communities that we're working with to eradicate guinea worm disease. That has been so valuable. That experience and that perspective has really influenced how I work, how I look at data, how I think about things on a daily basis. And it's not, you don't always get the opportunity to do that. And so I'm grateful for that opportunity because it really has given me good perspective for all of the other roles that I've had to be able to have that experience and understand what it is like for the communities, for health workers, for people who are trying to reach those locations. So, and I think the other thing is, it is, my role on a daily basis was, of course, this is a public health program, but 70% of what I was doing wasn't necessarily health related, right? I'm working on engaging community leaders or counting cups of sorghum for the community meeting or helping make sure there's firewood to cook the meal for them. I mean, all of these other little things that need to happen to make sure that we can focus on what's important and not be distracted by supply chain logistics and all of those other things. And so I think being open to all of the other parts that go into health and public health that aren't necessarily seemingly health related.
And maybe the segue to that is health. If I learned one thing when I was CDC director, it's that health touches everything. Public health touches everything. So you can't get mobilization of community without passing out whatever you were passing out in the cups. Like, health touches everything. One thing I learned the hard way at CDC was to ask the question, what can't I see? There were so many aspects of the work that I did that I could sort of see the implications of health. I could see the secondary implications. And somewhere down the line, somebody was going to be hurt or benefited from whatever it is that I was doing. And there is no better way to see what you can't see than by being there.
I'm looking through some of the questions and wanted to maybe do one more. And then we'll wrap it up with some thank yous. I know that it's snowing outside and folks are probably wondering what the roads look like.
You must be from Atlanta. I mean, snow?
I'm actually from New Hampshire. But I've been down south so long, I'm like, I don't have a jacket. What do you think one of the misconceptions is about guinea worm, either the disease itself or the eradication program?
I'm going to say, I just don't think it's been on anybody's radar. I just took the infectious disease boards in October. Thank you very much. And it wasn't on them. And not only it wasn't on them, it wasn't on the review course either. So you are talking to, even the deepest experts couldn't tell you the pathogen of guinea worm. So I think that part of this is there are diseases out there that we have the great fortune in this country of not even needing to pronounce or study. And they, even as recently as 30 years ago, affected 3.5 million people a year. Mm-hmm. So I think just bringing this to the forefront and sort of recognizing this work is happening.
I'm going to quasi-answer and then I'll kick it over to you. For me, even though I'm the one that asked the question, is that I think that how hard it is to change behavior, and that it's old school public health. It's sometimes not sexy. It's harder to count the wins. Sometimes it's easier to be like, we've given out this many pills or we've done this many surgeries. But to change someone's belief in order to change a behavior to therefore reduce and then eliminate a disease is takes a really long time. As Ernesto in the documentary had said, you can't buy trust, and it takes a really long time. That's what I wanted to share. Sarah?
I think you both have hit it on the head, but maybe the last thing to say is that it's not all, the inherent value of getting rid of guinea worm, even at a community level, is not necessarily always obvious to everyone. And so that health education and behavior change, it is important to have clear messaging and to do real engagement, because it's not just, as Dr. Hopkins said, I thought this would be obvious, the pure logic of it. That isn't always self-evident. And so thinking about how to articulate that message is very important. And underrated.
I thought his comment was striking, that they'd prefer to drink the water in the pool than the water from the pump, right? Just to highlight your point.
Well, with that, don't drink the water from the pond. And you all have a pipe filter. You're welcome to take them home. I think they're a great example that public health doesn't have to be expensive. There are innovations that are small. This design was actually created by the Tuareg in Mauritania, and we were able to take their suggestion and create something that lasts a little bit longer, and then take it to scale. And we've been able to use it not only with nomadic populations, but also with populations that are in conflict areas. So with that, I want to thank Dean Jorge. Thank you for having us, and the team at the Harvard Chan School for all the events, and the comms team, and everyone for coming out. I don't know if I missed anybody. Rochelle was the one that made this happen, so I want to do thank you. But maybe, I don't know if there's anything else you want to say to close us out.
No, don't be a stranger to the Carter Center. Thank you very, very much for allowing me this gift of a little two-family reunion, both at the Harvard Chan School of Public Health as well as the Carter Center. Thanks for coming from far and wide to be here. And, we have an incredible family in the world of public health, and we have many, many successes. And when people sort of start talking about how will you know when you can trust public health, I asked them if they brushed their teeth this morning with the tap water. Because if they did, they don't know how much they appreciate public health. So thank you all for the work you are all doing every single day, and thanks for the opportunity to be here.
Good night.